This conference will now be recorded.
All right, good morning, everyone. Welcome to the October monthly partnership meeting of the Southeastern Caribbean Disaster Resilience Partnership, or SCDRP. My name is Claire McGrath, and I have the honor of serving as the interim director of SCDRP. So thank you all so much for joining us today, and a very warm welcome to all of you. So our agenda for today is I'll start off with a couple of SCDRP announcements and updates. Then I will introduce our speakers, and we will wrap up with some partner sharing time. So please be ready to share your announcements from around the region, which you can drop into the chat, or you can turn your mic off at the end and share them. So first announcement for today is an exciting one. We are accepting nominations for the SCDRP Advisory Board. Nominations are open until October 31st. There's a number of seats up for election. You can see them listed here. They're also available on our website, and elections will be December 5th through 19th. Elections are for dues-paying members of SCDRP. There's a number of reasons you should join the advisory board. You can help us collaboratively shape the future of SCDRP's work and impact, and you can help us carry out our mission to strengthen resilience and emergency preparedness, response, and recovery across the region. You can also deepen your involvement in SCDRP's initiatives and activities, including our partnership meetings, our mentorship program, and our annual meeting. And you can also connect and network with professionals across the Southeastern Caribbean, including our fantastic team of current SCDRP Advisory Board members. So scan the QR code, or you can visit the SCDRP homepage and select 2026 board elections to read about the qualifications and to submit a nomination. And a reminder, you can self-nominate. And of course, if you have any questions, you can reach out to me. Next up, I'd like to share an exciting update on the Grow Mentorship Program. The program has launched. I'm thrilled to share that we have 68 total participants from across the Southeastern Caribbean. So we're really proud of the growth of this program, and the enthusiastic response that we've received has really demonstrated that we're filling a need in our region by providing professional development and opportunities for emerging resilience leaders in the region. So we are still looking for 1 or 2 mentors in the field of urban planning or land development, preferably in the Raleigh-Durham area. So we're looking for mentors who have at least 5 years of professional experience. And as a mentor, you'd be committing to participating in 4 total mentorship sessions. Those can be virtual, and it's anytime between now and March of 2026. So it's about a 5-hour commitment total when you include, we provide about an hour of training. It's pre-recorded, so you can complete that on your own time. Mentees are responsible for most of the prep work for mentorship sessions, including setting up a time and creating an agenda. SCDRP provides training, suggested discussion modules, and sample agendas. So email me at claire@scora.org if you'd like to learn more and volunteer. All right, and next up, we are thrilled to announce that the Southeastern Coastal Center for Agricultural Health and Safety will hold its 2026 State of the Science meeting in collaboration with SCDRP. The 2026 State of the Science meeting will take place on March 2nd to 3rd, 2026 at the College of Charleston, and it will be directly before the SCDRP meeting, which is on March 4th to 5th, 2026. So Farah and Ashley will be sharing a little bit more about that and about the work of the center. But Wanted to share that the theme of the 2026 State of the Science annual meeting is Change Among Our Working Waterfront, where attendees will explore evolving challenges faced by coastal communities and fishery workers. So this meeting will complement the SCDRP 10th annual meeting, Navigating Extreme Events, Doing More with Less Together, where we will explore actionable strategies for responding to natural disasters and extreme weather. So we're really excited for this chance to enhance both of our meetings. Registration for the 2026 State of the Science meeting will be available on the SCDRP 10th annual meeting registration page, and that's going to go live today. On the registration page, you have to sign up for each event separately, but it's the same page. And if you have any questions, you can reach out to me. I will be sending an email out to our newsletter subscribers today when that registration link goes live. So if you're not currently subscribed to our newsletter and you want to get this email, just drop your email address into the chat and I will make sure you get that information. Next up, a couple of announcements about our annual meeting. We're excited to announce our first confirmed speaker for the SCDRP 10th annual meeting. Mayor William Coswell Jr. is the mayor of Charleston, South Carolina, where our meeting is being held, and he will be giving a welcome address to help us kick off our meeting on March 4th. So his remarks will come directly before our keynote speaker, who we will be announcing soon. Our team of steering committee members has been hard at work planning the structure and content of the annual meeting. We're really excited to make this 10th annual meeting our most dynamic and interactive meeting yet. So this morning, I'd like to highlight one of our sessions. It's called From Hurricanes to Heat Waves, Emerging Insights in Disaster Resilience. This session will highlight emerging research in the field of disaster resilience and preparedness, response, and recovery, and it will feature researchers from College of Charleston and other institutions. This session will start out with a short presentation where our featured researchers will give a brief overview of their work, followed by breakout sessions where attendees can choose the topic that they'd like to dive into deeper. So breakout sessions will be organized by hazard type, including extreme heat, tropical storms and hurricanes, wildfires, and others. We're really excited to bring you this session and many others like it for the 10th anniversary annual meeting. And keep checking our website, and we'll be updating our agenda as we confirm our sessions and start to add speakers. We are seeking sponsors for the 10th anniversary annual meeting. So scan the code to view the meeting prospectus, or you can also visit the annual meeting website, which is listed on the slides. We're offering additional sponsorship levels this year, including several a la carte opportunities. And if you don't see an option on here that fits what your organization is looking for, reach out and we're happy to work with you to figure out a mutually beneficial sponsorship option. All right, next, it is my pleasure to introduce today's speakers, Farah Arosemena-Murfee and Ashley McLeod-Morin. Farah is an assistant scientist at the University of Florida Emerging Pathogens Institute and the program's director of the Southeastern Coastal Center for Agricultural Health and Safety, a center engaged in transdisciplinary occupational health research across the Southeast and U.S. Caribbean regions. She has brought a diverse educational and professional background, having worked with both domestically and internationally with vulnerable communities, implementing interventions to augment local healthcare systems with holistic, community-informed, and tailored programs. Farah has served on the leadership teams of multiple foundations, NIH and CDC-funded grants to provide strategic, tactical, and operational leadership of research portfolios, foster research collaborations university-wide and with community-based organizations, and advise on policy, procedural, and operational issues. She has been able to utilize public health and sustainable development expertise to guide the development of environmental and occupational public health research and programming to improve the well-being of high-risk and disaster-prone populations across the Gulf Coast region and the U.S. Caribbean. Her major focus is centered on integrating stakeholder feedback to improve safety and health practices in agriculture and fishing industries, two sectors that are often underserved in occupational health initiatives. Ashley is an extension scientist at the University of Florida Center for Public Issues Education and is the Associate Director of Communications for the Southeastern Coastal Center for Agricultural Health and Safety. Ashley has nearly a decade of experience as a strategic communicator, where she has developed award-winning communication campaigns on zoonotic diseases, communicable disease prevention, and environmental health risks. Ashley has collaborated extensively with interdisciplinary teams across life sciences and public health, resulting in a robust portfolio of social science research publications and science communication activities, including an annual State of the Science meeting. Ashley received her Ph.D. in agricultural communications from the University of Florida. And without further ado, I will pass things over to Farah and Ashley. Let me make you a presenter, Farah.
Thank you so much, Claire.
All right, thank you so much for being here.
And you're on mute, Farah. But while she's getting things pulled up, we're not used to go-to meetings, so thank you all for your patience a little bit. Even though we went through a practice session with Claire, a new platform always feels a little finicky. There we go. There's some slides. Well, we're really excited to share with you all a little bit more information about the Southeastern Coastal Center for Agricultural Health and Safety. Throughout these slides, you'll see SCCAHS as our acronym. It's not really an acronym that rolls off the tongue, so sometimes we call it the Ag Safety Center. But we're really excited to share more about our center, and we're really excited to partner with you all and SCRDP as we host our hallmark event, State of the Science meeting, with you all this year, your annual meeting. And so today we're going to talk a little bit more about what our center offers in general, but we also want to then dive a little bit deeper into what our State of the Science meetings have looked like and what you can expect this past year. So Claire gave a really great introduction of both of us, so we won't spend too much more time about Farah and I's background. But with that, I just kind of want to set the stage of what we're going to talk about today. I also want to let you know that you're going to see some QR codes throughout the presentation slides. If you want to scan those QR codes as they come up, it will take you to more information about what we're talking about on those slides. And so hopefully that is helpful for you all. Just a warning to get your phones out and get ready to scan some codes throughout. And so, yeah, I think that we can go ahead and move to the next slide, and Farah is going to tell you a little bit more about our center.
So our center is a ag center funded through the CDC, NIOSH, which is the National Institute for Occupational Health and Safety of Agricultural, Forestry, and Fishing Workers. Our center is one of 12 across the country, and we cover the Southeast region and the U.S. Caribbean. So we are covering Alabama, Mississippi, Florida, Georgia, North Carolina, South Carolina, the U.S. Virgin Islands, and Puerto Rico. Very large region, very hard to reach everything. And we overlap a little bit with some other centers that are funded through the CDC, the education research centers, and also total worker health centers. And we partner across, I guess it's now at maybe 36 centers, 12 that are ag centers, and then the total worker health and ERCs across the country. Our center is specifically tailored to focus on human health issues. And we have an evaluation and planning core, an outreach core, a research core, and a pilot program. So the pilot program is where we really try to expand smaller projects and reach across all the states and territories that we cover. Our key partners this round of our 5-year center, University of Florida, where we're housed, and then we partner with the Emerging Pathogens Institute, where I am, the Institute of Food and Agricultural Sciences, and the Extension Disaster Education Network. And also where Ashley is, the Public Issues Education Center is a big part of our outreach core. We also partner with the University of Georgia on both research programming and our biostatistical program is based there. And Ashley will talk a little bit more later about all of the community and industry partners that represent our Community Stakeholder Advisory Board and also our External Advisory Board. So our research program, which I'll speak directly to, is designed to be synergistic. Our first 2 projects are focusing on chronic kidney disease of unknown etiology. So we have animal-based studies that are directed by Dr. Chris Volpe, who's looking at how heat and pesticide stress affect kidney health in animal models. And then trying to, later on in his project, he'll move that into human studies, because what we don't know is, we do know that in places like Guatemala, we are seeing higher rates of chronic kidney disease, and we want to see if that's actually happening here in Florida. So he'll be studying that more specific to Florida. And then we have a statewide data infrastructure that we're trying to build for surveillance of chronic kidney disease. And that's run by Norman Beatty. He is an MD at the University of Florida, and also Yi Guo, who is his co-PI on that, who runs more of the bioinformation lab work. And so we're looking at electronic medical health records and working with federally qualified health centers to see what already exists, to see if this actually, if we can find markers in migrant health center data where this has been a longer problem than we've known. So they're looking at that. We also look at musculoskeletal interventions. So this started as a pilot program where we were looking at fishing industry workers in Florida, and now we've moved on to look at nursery workers in the Florida, specifically in the Apopka area and Plant City areas. And that program is directed by Kimberly Dunleavy, who is a physical therapist, a faculty member at the University of Florida, and she is building interventions to prevent injury and prevent the need, hopefully, for opioids, which is sort of an extension project on is that a problem? When we have these increase in musculoskeletal disorders, are we faced with workers who are now using opioids or relying on opioids more than they need to, and can we prevent these injuries? So Kim is working on that. We also have been very lucky to have a 4th project the past 2 years. Last year we were working with H5N1, which was led by Ben Anderson, and this year we're looking more at economic impact. And that's another Institute of Food and Agricultural Sciences project that's led by Nargiza Ludgate, which is, and then we have pilot programs. One of our hallmark pilot programs that we're actually continuing as part of surveillance is the agroforestry and regenerative agriculture worker health and the risk of zoonotic disease. And so that's led by an infectious disease doctor here at UF, Amy Vitter, and that's become rather exciting. And so we're continuing that as part into our next year of funding to look at it more, to keep that surveillance project rolling. Then there's the outreach program, which I'll let Ashley talk more about, but The point of our outreach core is to not only use the findings from our research core and help our PIs disseminate and translate that so the community can learn more about what we're doing and what the outcomes are, but they also work very closely with our community stakeholder advisory board and identify key concerns and address that in real time. So things that might not have been written into the grant initially 4 years ago, the outreach core really takes a bigger lead in addressing those needs through their outreach programming. Ashley, did you want to talk more about those things like mental health first aid?
Yeah, and we're going to talk extensively about those here in a few slides, but I really want to set the stage in how we work with our community partners. Like Farah alluded to, one thing that our outreach core leads is our community stakeholder advisory board. And on that advisory board, we have about 25 individuals that really cover a variety of industries and geographic regions and diverse communities throughout our large region. And we meet with them twice a year to hear about issues that are impacting their communities, their industry, their state, and their sector, and then be able to take that back to our center and think about how our researchers can use that information, but then also how we can partner together between what research is being done in our center and the needs of our community members to then be able to produce outreach products. And so, like I said, I'm going to talk more about these here in a few slides, but just to highlight some that I think would be most relevant to you all is our mental health first aid training that we were able to offer a few years ago. We offered this during 2020. And so if you all don't remember, we had a global pandemic going on during that year, but we were also coming off of a lot of major hurricanes that were impacting the Southeast. And there was some research done through our center partners that really identified the mental stress that our extension workers and our agricultural workers were undertaking, particularly immediately post disaster. And so again, we worked with some of our mental health partners to be able to provide online mental health first aid training specifically for agricultural workers and extension professionals. And it was a huge success. We were able to train over 200 individuals throughout the year of 2020 to really give them to empower them with some tools to be able to face those challenges that they were going through that year, but then hopefully to take into the future as we knew that they were going to be facing new challenges with the pandemic, but also continuing natural disasters that we know is going to continue to occur, particularly in the Southeast. If you want to go ahead to the next slide, talk a little bit more about that. So first, I wanted to set the stage in agricultural, fishing, and forestry disaster resiliency. So we know that you all understand disaster resiliency. You all are the experts in your communities and in these really diverse issues that come from disaster resiliency. It was really interesting for me to see you all introduce yourself in the chat and get an idea of the breadth from where you all come from, but also the breadth in the communities and the programs that you all work with. And so I just want to take a little bit of time to share specifically the communities and the industries that we're working with. And so whenever we're talking about disasters in agriculture, fishing, and forestry, what we primarily are looking at or dealing with and providing resources to are, of course, hurricanes, flooding, extreme heat, and also zoonotic disease outbreaks. So I know that that's kind of the oddball in the group, but like Farah mentioned, we most recently we worked with researchers on avian flu, and we really do see it as a natural disaster and how we can again partner with science and community needs to be able to offer resources related to those things. And so we've, in addition to the more traditional natural disaster situations that we know of, we've also been able to work a lot in that zoonotic disease outbreak area. Whenever it comes to specifically to disaster resiliency, we really, can you go back real quick? Thank you. Thinking about the ability for individuals, communities, as well as workforces to be able to prepare for, respond to, recover from, and adapt after natural disasters. We really try to keep the workforce in mind, particularly when we're thinking about agriculture, fishing, and forestry, to be able to provide them resources that they can use in the workplace to be able to ensure healthy and safe work environments for their employees. Whenever we're thinking of critical need areas, some of the things that we're highlighting and looking at specifically and trying to fulfill needs for through our outreach programs is the exposure of physical hazards, particularly during hurricanes or natural disasters. Thinking about the exposure of contaminants, equipment, environmental damage, loss of shelter. Loss of shelter was something that where we worked a lot with post-hurricanes over the past few years, particularly thinking of farm worker housing and how we can partner with some of our federal agencies to be able to ensure that our farm workers have resources that they know to go to help them with loss of shelter after hurricanes. Again, mental health and the stress burdens post-disaster, particularly for workers and extension professionals, really understanding what their need is, providing to them resources that can help make their job a little bit easier immediately post-disaster, and then again, empowering them with resources so that they can really be aware of and work in the area where they're getting it's a really heavy mental load that we know that they're facing. And then the disproportionate impacts for vulnerable populations, specifically H2A farm workers or small farm owners. You'll see that those audiences are considered deeply when we're putting together outreach resources for them. If you want to go to the next slide, this slide, we really, I tried to highlight a lot of the outreach resources specifically related to disaster resiliency in these areas that we've talked about. I should have mentioned this earlier, but what Farah and I are sharing with you all today is really just scratching the surface of the resources and the work that our center does. And so I really encourage you all to visit our website, SCCAHS.org. To learn more about all of the issues and topic areas that we provide resources for. But if you want to scan this QR code, this is specifically going to take you to the resources that you see on the screen, and these relate specifically to disaster resiliency. And so the first two here, we put together some information toolkits related to disaster preparedness and resiliency, as well as heat-related illness. And so for both of those topic areas, we pulled together already existing fact sheets, handouts, and resources, but then also developed other resources that were a particular need. And one really exciting resource that we offer through our heat-related illness toolkit is a heat preparation template for local or for small business owners, particularly on the farm. And again, this was something that came out of our advisory board that really highlighted that this was a need coming up that was going to be more regulated, but our owners needed help providing, being able to produce these heat safety plans for their farm. And so we've developed some templates for them to use that can be used even beyond the farm, but that's what we particularly had in mind when developing those. We also have a deep repository of webinars where, again, we partner with researchers in our own center or researchers that are working on topics related to these subject areas, and all of that can be found in those repository areas. Again, thinking about extension agent and community leader engagement, we provide a variety of training and guidance, particularly for trusted community leaders and extension agents to be able to use and expand resiliency outreach and support. And one of those areas that we've talked about already is that mental health first aid training. And that's something that we hope to regularly be able to provide. We haven't been able to in the recent years. Like I said, the last year where we were able to do a lot of that was 2020. But we've been talking about being able to provide that again here soon. And so that's something that we hope to do. You've all have heard a little bit about our State of the Science meeting. In the past, we have, and we're going to talk more about our State of the Science meeting here on the next slide, but we've been able to put together these meetings that have been really forums, particularly for areas that relate to disaster resiliency from a mental health perspective, stress and resiliency in vulnerable communities, and to be able to share research and interventions for a variety of people to be able to work on and use. And so we're excited to talk to you a little bit more about that here in the next few slides. And then we also have some other more dynamic resources. Most recently, a short film that is entitled Defending Puerto Rico's Ocean Economy, the Importance of Fisher Health and Safety. And this was informed by some of our work in Puerto Rico at this past year's State of the Science meeting. I'm really highlighting the work in the commercial fishing industry for small scale fisheries. Again, they're in the Caribbean region. And currently we're working on a short film that is highlighting the rural coastal impacts of rural coastal towns, particularly on the Gulf Coast, and how those small rural towns have been impacted by recent hurricanes. And that is something that you can look forward to in the spring of 2026. We hope to have that actually at least soon to the time that we meet with you all. So hopefully it'll be ready and finished by that time. Go ahead to the next slide. And so now I just kind of want to tell you a little bit more about our State of the Science meetings, how they came about, and some information in general about these meetings. And then we're going to dive into some more specific things that we've done this past year and what we hope to do whenever we meet with you all in 2026. So the purpose of these meetings was really to bring together our researchers, but also our practitioners and the people that were out in the industry and representing their community. And so we had our first meeting in 2018, and it soon became a hallmark event that really led the center's mission of research to practice. Again, we bring together interdisciplinary scientists. So we're bringing together scientists that are working in public health, in agriculture, in various different disciplines, and bring them together on issues that they're all working on. And so we hope to answer questions, but also explore innovations that our community and our practitioners can use. So the meeting objectives are to provide a platform for speakers to deliver insights on emerging issues and innovations impacting ag-FF health and safety in the Southeastern United States, to implement networking opportunities to advance collaborations among industry, public health, and science, and to evaluate, translate, and disseminate research to practice findings into public information products. And if you want to go ahead to the next slide, Farah, we will talk about a sampling of what our State of the Science meetings have looked like in the past. And again, if you want to scan this QR code, that's going to take you to our landing page for the State of the Science so you can get more information on all of our past meetings and to just get an idea of what they've looked like. Our first State of the Science meeting focused on heat-related illness. And so that meeting was really cool, where we were able to bring together public health scientists, again, agriculture scientists, but then also scientists that worked with military professionals and athletes and what they did in order to help protect those communities whenever it came to heat. And so again, we were all really able to learn from each other and in disciplines that maybe we weren't necessarily working with. And we really hope that these scientists that coming together are able to network outside of their own discipline and bring their knowledge and their resources to other disciplines like ag, fishing, and forestry. The next year, we focused on stress and resiliency, specifically from a mental health space. And so again, bringing together diverse researchers and diverse practitioners to be able to explore mental health and how it impacts workers in agriculture, fishing, and forestry. And then, of course, the next year, 2020, we focused on global pandemics, but particularly how global pandemics beyond just COVID-19 impacted the agricultural workforce and how we could prepare for hopefully not similar outbreaks, but similar challenges in the future from a workforce standpoint. The following year, we focused on health equity, and then in 2023, we wanted to look at how the climate was affecting agriculture from a health and safety standpoint. And then finally in 2024, we looked at rural healthcare and some of the challenges that were happening in these rural communities. And again, some of the solutions to address those challenges coming up. And now I'm going to have Farah talk about our 2025 meeting that we were able to host in Puerto Rico earlier this year.
So as Ashley mentioned, we started this in 2018, the State of the Science meeting, as a tool for outreach, for our outreach core. And Ashley and I said, hey, we're not focusing enough on the Caribbean, and how can we leverage what we've done over the past several years and move this into its own niche. And so we applied for funding, a U13 funding, and this is meeting and conference planning funding from the federal government to specifically target coastal and fisher health fisher communities, and the health of these populations. And so we designed a program and wanted to convene it in the Caribbean, not have people come to us, but have us go to them. And we convened it in San Juan, Puerto Rico in March of 2025. We had 65 attendees for this meeting. And the core of it was really to have a community voices panel, to hear first from the actual community, the leaders in the community. It was centered in Puerto Rico, and to hear what their biggest obstacles were. And that sort of set the stage for how, once that community voices panel was set, it kind of set the stage for how we built the rest of the program. And so we had a research and extension panel, we had an opportunities and solution panel, and we also brought a special session on social network analysis to really see just how well our networks are working, and how we can bring these social network analysis methods to smaller organizations, fishing associations, and then help them target how to grow their networks more successfully and be able to influence policy better. And so that was the key of that special session. God, it's a tongue twister. And we always have a poster session that kicks off the event. And so that allows for a networking method for all of our attendees. And I would say that's probably the most well attended. That's when we get our all 65 people together at one time. And that always kicks off more conversation and creates, from our evaluation of the meeting, is always the one that gets the best, the greatest accolades. So that was the design of our meeting this year, working more with sea grant groups from across the region. University of Puerto Rico has a sea grant group, local fishing associations. Puerto Rico has a robust group of community leaders leading their fishing associations, very, very active. So that was super exciting. And environmental health scientists, and NOAA as well. I'm trying to think of larger groups that hadn't typically attended our previous State of the Science meetings came to this one. And so we want to continue that into our second year of funding for this State of the Science Health Safety of Gulf Coast and U.S. Caribbean Fishers. So we plan to have a similar group. We're going to stick with this same format for 2026. And that's what I have for that. And with that, I want to share with you the save the date that was created. Again, as Ashley mentioned early in the presentation, and also as Claire mentioned, we're going to do, the theme is going to be change among our working waterfronts. So that can encompass all of the issues being faced by fishing groups and coastal communities.
Yeah, we're really excited to partner with SCDRP this year, or in 2026, to deliver the State of the Science meeting. And so we look forward to having many of you join this pre-conference session. And we'll also share our contact information on the next slide. If there's anything particular that you want to see, we would love to hear from you all about that. And then here soon, we hope to announce our call for poster abstracts. Again, like Farah mentioned, our poster session is always one of the highlights of the event. And so we hope that you all will share that poster call with your students or colleagues that you work with. And then maybe you specifically will be able to put something together in that call. And so again, we're just really excited to be able to partner with this organization this year and to deliver what we hope and we know will be another really successful State of the Science meeting. And so hopefully we have some time for questions. I think I lost track of time a little bit, Claire. But if not, here's our email addresses, and we're happy to answer any questions or take any feedback via email.
Yeah, thank you so much. And we do have time for questions.
Good.
Timed it perfectly. So we'll open it up to, you can either raise your virtual hand, turn your mic off and ask a question. You can also put questions in the chat and I'll monitor that. Yeah, Manuel.
I was able to participate in that meeting this year in Puerto Rico. I was excited. All of us that participated loved it. We still talk about it. A lot of the initiatives that you guys presented has been discussed without talking about heat waves with fishers, communicate that health and risk with them has been great. And I'm excited that you guys are working in this collaboration together, and excited for next year's conference.
And we didn't even pay Emmanuel to say all of those things. That was a live testimony, though. That's great.
This meeting is recorded, so we're going to clip that.
Yeah, exactly.
Use it as a promo.
That's the commercial right there.
Right. Yeah. Excellent. Any other questions? And I'll jump in. I think it's really impressive how it sounds like you all do a lot of outreach successfully to smaller, more rural communities, and like have pretty close working relationships with some of these smaller communities. And I'm curious, especially in kind of how maybe some of the strategies you use or how that works, especially when it relates to the mental health outreach around disasters. I know in some small rural communities, agricultural communities, mental health is not talked about as much. And the same resources that might exist in more urban areas don't necessarily exist in some of those smaller communities. So I'm curious about like how you have those conversations and how you specifically around mental health, and how how you're able to like invite people to be receptive to those types of conversations.
That's a really great question. And to be honest with you, we can't take much credit in that at all. I think that we have a lot of really great partners that we lean on for those conversations and those delivery of resources. And so Farah mentioned early on, we work with the Extension Disaster Education Network. And so Dr. Angie Lindsay, who some of you all might know, she's a part of our outreach group, and she's one of the Florida's point of contact for the Extension Disaster Education Network. And she's able to partner a lot with not only local extension, but then also mental health experts that are throughout the region and throughout the state. And I think that also extension, not only in Florida, but in other states in our region, has done a really great job of opening up that conversation of mental health, particularly in rural communities and in agricultural workforce groups. And so again, being able to partner with those folks that really understand their own communities, and knowing what will be successful and what won't be successful, but then also really identifying a need and being able to address that need, I think makes those communities a lot more responsive during that time. We actually have a lot of folks on our outreach team who come from rural communities. Myself, I come from a really small town in the Florida Panhandle. And so we really have a heart for the rural communities as well, and also acknowledge that the small town that I'm from is very different from the small town that I now live in. And knowing though that one common thread is being able to lean on those trusted partners in those communities. And we know extension professionals, which I see a lot of extension professionals on this call, is one of those major groups that making sure that they have the right resources, but also making sure that they're taken care of during those tough times as well, so that they can show up as best as possible for their communities.
And something that, I just had this conversation with a PI of one of our research programs who collects survey data, and some of the things they look at are anxiety and depression. and how much stigma has been lifted, that people want, that the community wants to talk about the mental health issues that they're seeing. And so it was refreshing for her. We also have a clinical psychologist who has led a pilot program and is on a research program in the larger research core. So we have resources to provide to the outreach core, which is terrific.
Yeah, thank you. That's all really interesting and encouraging to hear that, according to that survey, some of that stigma is being lifted. Any other questions? And if not, I will open it up to any partner sharing. Does anyone have any announcements, calls for collaboration, anything that they want to share with the group? And you could drop those in the chat, and I'm happy to share them in our newsletter, which will go out tomorrow. Emmanuel.
I gotta make that check. No, just to comment. Currently starting doing my PhD in North Carolina, so I'm gonna be close to where the conference is gonna be on. Let me know if you need any help from where I'm from, so we can keep collaborating. Again, love your work, love what SCDRP is also doing. It's again excited for this collaboration. Have a good one, guys. Thank you for everything.
Excellent. Thank you. All right. Well, with that, I think we will end a couple minutes early. Thank you again, Farah and Ashley, so much for being here. We're really excited about this collaboration. I think it's going to be a fantastic opportunity for both of our organizations to expand our networks. And so I'm looking forward to being at both meetings. And as I mentioned earlier, we will be opening up registration today. So again, if you're not already on our email list and you want to make sure you get that announcement, then drop your email in the chat. I'll make sure that you get the registration link. But thank you so much for being here, and I hope everyone has a lovely rest of your day.